Good afternoon. We are here today in defiance of President Donald Trump's budget cuts to essential services for Americans. You'll hear about how President Trump's budget cuts and freeze of federal government, federal grants are negatively impacting people in our community. We are only 1 month into the second Trump administration. 1 month and people's lives are being turned upside down. But President Trump doesn't care about people like you and me. He gave free rein to Elon Musk, a billionaire, to make cuts in the name of efficiency. Elon, who was never confirmed by the Senate, never elected by the American people, now wields immense power. And by the way, from Elon Musk's federal contracts, he makes $8 million a day just from his federal contracts. Elon and his team of unqualified workers at Doge have fired hundreds of federal employees, not due to merit, but because he deemed these public servants expendable. They fired people from USDA while there's bird flu. Egg prices, as we know, are skyrocketing. The staff cuts to the Federal Aviation Administration are a direct threat to people's safety. Since his inauguration, have we gone a week without turning on the news and seeing a tragic plane crash? I'm so grateful that the 80 lives aboard the Delta flight that crashed in Toronto survived. But 67 families are still mourning their loved ones from the plane and helicopter crash in our nation's capital. It is not lost on me that while Trump fires qualified, dedicated, good workers, he blames diversity, equity, and inclusion for every tragedy that happens on his watch. He blames DEI not because it's responsible, but because it's an easy target, because fear and division are his most effective tools. Yet he wages his culture war. He ignores the real crises threatening our communities. Americans are facing higher costs of living. House Republicans promised to lower those costs. They lied. Their new proposed budget would cut $880 billion from Medicaid. In Illinois' 2nd Congressional District, 17,000 people covered by the Affordable Care Act will see their premiums go up by over $1,000 a year. Almost 300,000 people on Medicaid will lose health care. Over 70,000 people won't be able to put food on the table without SNAP. Elon Musk, now in control of the Treasury Department's payment system, can stop Social Security benefits on a whim. That would affect over 150,000 people in our district, including almost 12,000 children. Why are they making these cuts? Because they want to give $4 trillion worth of tax breaks for CEOs and large corporations. Republicans control the White House, the Senate, the House, and I would say the Supreme Court. With all this power, they decide to give more money to the wealthy. They decide to step on the American people who are already trying to make ends meet. House Democrats are doing everything we can to stop the steal. We introduced the Taxpayer Data Protection Act to fight Elon Musk's unfettered access to your Social Security benefits. This would ensure your private information is safeguarded. If just 3 brave House Republicans side with the American people, we can pass this critical bill. Just 3 from anywhere in the United States. We've met with Democratic governors, Democratic attorney generals, and different national organizations to fight back against Trump's unconstitutional actions in court. We've hosted rallies outside the Treasury Department, the Department of Education, and the Department of Health and Human Services. I choose to stand against corruption and self-interest that put lives at risk, because behind all the stats and the numbers I just shared are real people. Now you'll get to hear from them. It is my pleasure and honor to introduce Mayor Vernard Alsberry, who's hosting us in his city of Hazel Crest. Mayor Alsberry.
Thank you, Congresswoman Kelly, and welcome to the village of Hazel Crest. It has been a month since President Trump returned to the White House, and the confusion and turmoil enumerating from the 1600 Pennsylvania Avenue are both alarming and disheartening. Federal spending freezes are cutting essential services while veterans, seniors, and students. There's an attempt to dismantle DEI programs without acknowledging the system's injustice that's led to the establishment. Furthermore, Trump's tariff policies are resulting in hundreds hundreds of thousands of dollars in extra costs for residents, whether at the grocery store or when purchasing a home. These policies seem to benefit only the wealthy while placing additional burdens on some of the most marginalized groups in our nation. As mayor, I recognize the necessity of an efficient government as responsible managers, manageable tax resources. However, I'm deeply troubled by the indifferences and lack of concern for ordinary Americans being shown by the Trump and his administration. Take for assistance, administrative tough policies. Many essential materials for home construction come from countries like Mexico and Canada, raising construction costs while ultimately being passed on to the home buyers, making it increasingly difficult to purchase homes in numerous communities across the region. These same communities are already grappling with the escalating property taxes that we see here in the Southland. And the Trump tariffs will only increase these economic challenges. Local governments may also face higher costs for capital projects, further increasing expenses for materials needed to repair fire hydrants, water mains, and local roads. Businesses dependent on imported goods are encountering increased costs due to tariffs, and which will lead to higher prices for consumers. In summary, while Trump's policies won't reduce the prices of eggs, it will take money out of your pocket and direct it toward the billionaires who are clearly his policy. The time to act is now. I urge you to contact every Republican congressperson and senator in Washington, D.C. When you reach out to their offices, remind them that Congress is a co-equal branch of our Constitution and democracy, and that they must fulfill their role of checks and balances across the administration of President Trump. So let's get on our phones, let's reach out and talk to them. As the Congresswoman says, it only takes 3 individuals to stop the steal. Thank you so much. And now I'll pass it on to the next speaker, Becky Gremley. Thank you.
Hello, my name is Becky. First, I would like to thank Congresswoman Robin Kelly for this opportunity to speak here today on behalf of my autistic son, Oliver. Oliver depends on the accommodations of the Board of Education, Medicaid, insurance, and DEI. The first thing Oliver said to me the morning after Trump became president was, "Mom, what's going to happen to me in my future? I'm scared." I, of course, reminded him that no matter who is in office, no matter what happens, his father and I will be there to support and fight for him like we always have. Hence why I'm here today. I am an advocate for my son, Oliver. He is 17 years old now, a junior in high school, and was diagnosed with autism at the age of 10 years old. My concern now is, how does my son's future look if Donald Trump dismantles the Board of Education, cancels or freezes Medicaid again, and gets rid of DEI? All of those impact Oliver directly and his future. DEI is obviously going to impact him due to my son having a disability. He will struggle to get a job with companies who do not participate in DEI. But I'm here to concentrate on the dismantling the Board of Education and the freeze or cancellation of Medicaid and the effects it has had or will have on my son's future. Currently, my son has Medicaid due to his autism and his asthma. As of now, if Medicaid gets canceled, he can go on our insurance. But when he turns 26 and he is an adult, Medicaid is the insurance that he will receive. Without Medicaid, it will make life extremely difficult for him to carry insurance and take care of himself. Now on to the importance of the Board of Education. The Board of Education is the reason for Oliver's resources and accommodations that he needs to be a successful student and classmate. He gets these accommodations all the way through college. He was diagnosed when he was 10 years old. Before diagnosis, he struggled with following direction, staying focused, struggling with peers, and severe bullying. Once we had the diagnosis, We got him accommodations and resources immediately. He is now a successful junior in high school, currently is a straight A student with a 3.8 GPA, honor roll. We're very proud. Also a decorated cadet of the ROTC program. Without these accommodations of the Board of Education, I'm not sure where he would be and how successful he would be. He is now successful and thriving because of it. We are grateful for his IEP, which is an individual education program, his 504, his counselors, his social workers, and caseworkers. They are the team that has helped us support Oliver in his needs for school and social situations. So again, if President Trump succeeds in dismantling the Board of Education, canceling Medicaid, and/or DEI, that will jeopardize my son's future education and make it harder for him to be a successful, independent adult. So I will keep fighting, and I hope you do too. Thank you for your time. And now I'd like to introduce the next speaker, John Peller.
Good afternoon. I'm John Peller, President and CEO of AIDS Foundation Chicago. Thank you so much, Congresswoman, for having us and for being such a champion. I want to start by telling you the story of one of our clients I recently connected with, and this is a real story about the impact of federal programs on the lives of people living with HIV. Our client grew up in Chicago and was 24 when he got the life-changing news that he had HIV. At age 30, he had a serious mental health crisis and ended up homeless. He eventually connected with us at AIDS Foundation Chicago, where we linked him to medical care and got him an apartment. Today, our client says, stable housing is everything. You can't stay healthy if you don't know where you're going to sleep. Now, his viral load is undetectable, meaning he's healthier and can't transmit HIV to his partners. He's employed, stably housed, and gladly shares his story with others who are newly diagnosed to empower them. Thousands of AFC's clients achieve greater stability thanks to a constellation of federal programs that provide critical support, like Medicaid for healthcare and mental health and substance use services, the Housing Opportunities for People with AIDS program, which AIDS Foundation Chicago uses to support 1,300 people living with HIV, case management and HIV medications through the Ryan White program, and more. But every one of these programs is under attack by Donald Trump and Republicans in Congress who want to use them as a piggy bank to pay for tax cuts for millionaires. These programs won't be here when the next client who is newly diagnosed with HIV comes to our door for support. And let me tell you, we get a lot of calls. There's 1,500 people living with HIV newly diagnosed in 2023. And while we're making great progress in reducing the number of people newly diagnosed with HIV, the people who will be most impacted are Black and Latinx gay men, Black and Latinx transgender women, and cisgender Black women, because those populations are most impacted by HIV. I want to thank Congresswoman Kelly for being an incredible champion for health equity in HIV. And she has just taken on a new challenge because her plate isn't full enough. And that's leading the fight to reauthorize the PEPFAR program, or President's Emergency Plan for AIDS Relief. PEPFAR is the world's largest program for HIV medications across the globe. And it provided HIV treatment to over 20 million out of the 40 million people living with HIV in the world. But soon after coming into office, Donald Trump tried to pull the plug on the program, and we are already hearing about babies who are being born with HIV because their mothers couldn't get HIV treatment. That's a totally preventable occurrence, and it should never happen in 2025. What happens abroad impacts us in the United States. Look at the COVID pandemic and look at Mpox. PEPFAR is estimated to have saved 26 million lives because people can live long, healthy lives when they have access to HIV medication. Today, we must fight hard against cuts to vital programs like Medicaid, the Ryan White program, the Housing Opportunities for People with AIDS program, and PEPFAR to ensure the health of our communities globally, nationally, and locally. Thank you. And next is Veronica Clarke, President and CEO of TCA Health.
Thank you, John. And I want to thank the Congresswoman and her staff for giving us an opportunity to speak here today. So, as John said, my name is Veronica Clarke, and I'm the President and CEO of TCA Health Center. And we're a federally qualified community health center on the far south side of Chicago. For 60 years, community health centers have been the backbone of primary and preventive care, providing effective, affordable, and comprehensive service to communities across the nation. Health centers serve over 1 in 6 Medicaid beneficiaries nationally, with nearly half, that's about 49% of all health centers patients relying on Medicaid for their care. Community health centers are open to everyone, regardless of their ability to pay or insurance status, and they generate tremendous value by keeping communities healthier and reducing overall healthcare costs. Nearly 2.4 million medically underserved Medicare beneficiaries depend on community health centers for high-quality, comprehensive care. Medicare patients make up to 9% of all health center patients nationally. And in some community health centers, particularly in rural areas, this number is significantly higher. At least 15% of total patients are Medicare beneficiaries at 1 in 5 health centers nationwide, demonstrating their critical role in serving older adults. So in Illinois, 1 in 9 Illinois residents rely on community health centers for their care, whether it's dental, vision, behavioral health, or medical. They rely on community health centers. 16% of these patients are uninsured, 60% covered by Medicaid, and at our health center, that's 80% of the population we see on the far southeast side of Chicago. Illinois has 56 community health centers across the state with over 400 sites, so there's one in almost every community, serving 1.5 million patients, ensuring access to vital healthcare services for some of our most vulnerable residents. In Congresswoman Kelly's district, there are 13 of these federally qualified community health centers that serve over 526,000 patients. According to Georgetown University, McCourt School of Public Policy advises that Illinois in the 2nd District had over 178,000 people who are covered by Medicaid CHIP in 2023. I don't have the 2024 numbers, but I'm sure they're higher. That is the largest in the state with 30.9%. So staggering in the 2nd District only. Across Illinois, community health centers contribute up to $2.1 billion in Medicaid savings, providing their value in reducing healthcare costs while maintaining high quality care. One would ask, why should we protect Medicaid, right? Adequate Medicaid and Medicare reimbursement is essential to sustaining comprehensive, high-quality care in low-income communities. And I'd like to share a story of one of our patients. We have many stories, right? But a patient came in to see one of our primary care providers and was due for colonoscopy, similar to how we're, at age 50, it seemed like at that age you're due for many, many tests. She received a referral from her physician, but for some reason never scheduled the test. However, our team continued to remind her until she finally said, I'll go and do get my colonoscopy. That decision saved her life. She was diagnosed with early stage colon cancer, something she may have never known about if not for our physician's presence and that persistent, reminder. Because of early detection, she was able to seek treatment in time. She's one of our many Medicaid patients whose health was safeguarded by access to essential care. Stories like hers are common at our health center and many health centers in Chicago. Yet proposed cuts to Medicaid and Medicare threaten the health and well-being of patients like her. It is critical that we work together to protect and strengthen these programs, ensuring continued access to care for our most vulnerable patients. Our message is clear. Protecting Medicaid and Medicare is not just a fiscal responsibility. It is a moral importance. We save lives, we keep people out of the hospitals. If people lose their Medicaid, if there's any kind of cut, we're on the hook for that. So like the Congresswoman takes, we just need 3 from the other side, just 3. Let's make these calls, let's talk to our elected officials to support Medicaid and continue serving, so we can continue serving vulnerable population and saving lives. Thank you. So I'd like to introduce the next speaker, Dr. Michael Boyd, President and CEO of Kankakee Community College.
Good afternoon.
Good afternoon.
And thank you, Congresswoman Kelly, for inviting me to be a part of the conversation very much. KCC, we know that we're doing our job. We're meeting and accomplishing our mission when we can connect our students to family-sustaining careers right in the communities where they live, the communities that they call home. That's what we do well. And when I talk with business and industry leaders as we work on that mission, they tell me a number of things. And one of them is they're ready to hire our graduates. They're ready to hire employees. They also tell me that they're ready to pay family-sustaining wages for those employees who are ready to go to work. And they also tell me that a K-12 education and some level of post-secondary education or training is absolutely vital for success in today's workforce. Education is economic development. But connecting with today's youth, that's a challenge. It's a complex challenge, and it's no more challenging than when we're trying to connect with youth who are experiencing the trauma of poverty. And the symptoms of that trauma prevent, impede, impair their ability to dream about a future for themselves, to think about where they're going to go, and to make a plan for their own success. Forget about a dream deferred. If a young person experiencing the symptoms of poverty doesn't even have the capacity or ability to dream about their future. But your K-12 educators, your community college educators, we have taken it as central to our mission. Is what we're trying to do is connect students from every background, from every community, with family-sustaining career pathways. It's our mission. We've taken on that challenge, but we need help to do it. And that complex work requires help. It requires help oftentimes from federal grant support. Title I grants for impoverished schools, Title I grants for impoverished students, transportation assistance so that students can get to safe schools where they can learn and dream about their future. We heard today about special education programming and how important that is to provide students access to high quality learning that meets their needs. Those are resources that ensure that every student, regardless of the context in which they live, their background, their family's income, can access relationships that matter, quality educational content that matters, safe schools. That's where they're going to learn the knowledge, the skills, and the habits of mind that lead to success for their future. A career pathway starts with a good K-12 education, and it leads to a post-secondary experience, credentials at a community college, perhaps a degree at a university. But how do we make that connection? At Kankakee Community College, we make that connection through our TRIO programs. TRIO supports middle school students, it supports high school students, and it supports community college students. TRIO programs, federally funded programs, bring all of the partners together for a singular purpose. And that is making sure that every student has access to the benefits of a college education. At Kankakee Community College, we serve well over 800 students every single year in the city of Kankakee and in Pembroke Township. And let me tell you, those resources are vital, especially for our low-income students in the region. And that's just the start. Making the connection from K-12 to post-secondary is just the start. We also have to enable our young people to earn those credentials, those valuable credentials, in a way that prevents them from being shackled with the burden of student loan debt. And these are also vital resources. Pell Grants, adult education, ESL, other sources of federal aid like Perkins. These aren't inefficient. They're not government waste. For the students that my colleagues and I serve at Kankakee Community College, these resources are a lifeline. They're absolutely essential. And so is our ability, as educational leaders, our ability to maintain safe, clean, technology-rich instructional facilities, educational facilities. Costs, let me tell you this, costs for instructional materials alone have skyrocketed. Instructional technology continues to increase in costs. But what's rising even more dramatically are the costs for construction materials and construction supplies that we need to address the deferred maintenance in our aging and deteriorating schools and colleges. These are the places where our students learn. These are the places where our students dream about their future. And it's the place where our students connect with family-sustaining careers. Education is economic development. Education is an investment in our future. It's an investment in our communities. And any level of disinvestment in our education system and disinvestment from student support systems simply is not an option. Thank you. And let me introduce next Debra Shore, former regional administrator for EPA Region 5.
I'm Debra Shore. Until a month ago, I served as the regional administrator at the Environmental Protection Agency based in Chicago, serving 6 states and 36 tribal nations. And I've never been more proud in my life than the day I was appointed to join a team of such smart, devoted professionals who have a shared sense of mission. On Friday of last week, hundreds of people at EPA and thousands across the nation received an email summarily dismissing them from their posts without cause, without recourse. They were told at 4:30, you're dismissed, and at 5, their computers were shut off. They could not even file any kind of appeal or access their own personnel records. These were people who had waited months and years to get some of the jobs they had, and some were not new employees, but merely had been promoted to a new post or transferred laterally to another agency. Let me tell you about some of these smart, devoted professionals. They're what EPA calls on-scene coordinators, the emergency responders who show up at the scene of train derailments and warehouse fires, at oil spills, and who assist in the cleanup of wildfires and tornadoes and floods. These are the lawyers who make sure that polluters pay for the costs of polluting our environment. These are the scientists studying the effects of toxic chemicals. And these are community outreach coordinators working in communities that have been ignored and unheard for far too long and that suffer the burden of polluted air and water. So today, the safeguards that we have enjoyed for 50 years to protect our environment, to make sure that all Americans have safe water to drink and clean air to breathe and don't have to live in places laced with toxic chemicals, those safeguards are in peril because the administration has willfully, thoughtlessly, recklessly, and cruelly sought to dismiss these professionals who want nothing more than to serve the public and to do it every day with devotion and integrity. The federal professional civil service took a century to build. and is a signal achievement of our democracy. And instead, they wish to systematically dismantle it and install a patronage system where what matters is not what you know, but who you know. Well, we in the Chicago region certainly know that patronage can be corrosive and corrupt, and nobody wants to kneel down in fealty to the king. So thank you, Congresswoman Kelly, for fighting every day for us. Back over to you.
Well, I want to thank all my speakers and for sharing your powerful stories. And these are just a few stories. Before I came here, I spoke to a group that told me all of their stories about senior citizens, people with dementia, and people disabled. And my colleagues are hearing stories from thousands of people across the country.